Good afternoon. My name is Neil Arwin Mercado, reporter for INQUIRER.net. Our fight against the coronavirus disease seems to be far from over. As of July 21, COVID-19 cases in the country have breached the 70,000 mark, and experts see this number to continue to increase. Of course, when we talk about COVID-19, we also have to talk about testing. And to talk about just that, we are joined here by former Health Secretary Manuel Dayrit, who also led our successful fight against SARS back in 2003. Good afternoon, sir. How are you?
Good afternoon, Neil.
Good afternoon. How are you, sir? How is kamusta, sir, ang quarantine so far? Saan kayo based right now?
Yes, well, I stay home.
At home lang kayo, sir. So, sir,
yes.
So as I said noong introduction ko kanina, sir, I want to talk about testing, sir, specifically rapid testing, because DOH meron silang mga pronouncements about them not recommending itong rapid testing. Even on my personal experience, sir, I have friends telling me that they've been cleared of COVID-19 because they underwent rapid testing, sir. Sir, for our viewers right now, sir, can you explain, sir, define first, what is rapid testing?
Well, rapid testing as defined now refers to the antibody tests.
Mm-hmm.
They call it rapid antibody tests.
Mm-hmm.
What you measure is in the blood are the presence of antibodies
Mm-hmm.
that the body produces against the virus.
Mm-hmm.
So that's what you measure when you talk about a rapid antibody test.
Mm-hmm. So, sir, yung DOH, meron silang mga previous pronouncements nga, like I mentioned earlier. They've mentioned that COVID-19 rapid tests, they are not ideal for mass screening of workers, especially during the height na papayagan na nating bumalik sa field ito or sa workplaces itong mga workers natin. Diyan lumabas yung how do we ensure that they are safe in the workplaces. Diyan umangat yung conversation that they can undergo rapid testing. But the DOH has said that it's not an ideal thing to do to ensure yung safety nila. Sir, what makes rapid testing na hindi recommended for COVID-19 tests?
Okay. Siguro, Neil, umpisa natin sa the type of tests that are now present.
Mm-hmm.
Nabanggit na natin rapid antibody test. Na-explain ko na yun, di ba? And I will make an analogy there.
Mm-hmm.
Yung isang test, yung tinatawag nilang RT-PCR.
Mm-hmm.
Okay, yung RT-PCR, what that means is it's a test to detect the presence of the virus in your body.
Mm-hmm.
And usually, the test is done by getting a swab of your nasopharynx. So yung likod ng ng ilong mo at saka ng lalamunan mo, doon sa likod. Kasi doon unang pumupunta yung virus.
Mm-hmm.
So kukuha sila ng swab doon. Tapos yun ang gagamitin nila para hanapin kung merong ma-detect silang virus doon sa nakuha nila sa swab.
Mm-hmm.
So, malaki na yung diferensya no? Yung RT-PCR, you detect the actual virus.
Mm-hmm.
Kung nandun talaga. Yung rapid antibody test, ang dinidetect mo yung antibodies against the virus.
Mm-hmm.
Okay? And yan, kinukuha mo sa blood, hindi mo nakukuha sa swab.
The swab. Mm-hmm.
But siguro, mas madali siguro intindihin kung may tayo dito, may analogy
Mm-hmm.
or story. Okay? Ihambing natin, i-compare natin yung virus sa magnanakaw.
Mm-hmm.
Yung magnanakaw, nanakawin yan yung kalusugan mo.
Mm-hmm.
Nanakawin yan yung hininga mo. Okay? Yung magnanakaw na yan, papasok sa bahay mo. Ang test na gusto natin ay yung mahuhuli mo yung magnanakaw na nandun siya.
Mm-hmm.
Yun ang gusto natin makuha. Makuha natin yung magnanakaw mismo.
Mm-hmm.
Pero, yung magnanakaw, pwede pumasok sa bahay mo. Tapos, umalis.
Mm-hmm.
Pero may mga naiwan na mga ebidensya na nandun siya. Halimbawa, kung meron kang video cam, nakuhunan mo ng litrato yung magnanakaw. O kaya kung meron siyang naiwan, nagwantes o ano. O kaya kung merong nawawala. Yun mga ebidensya na nandun yung magnanakaw. Pero wala na yung magnanakaw. Hindi mo na, wala na. So kung titignan natin yung mga ehemplo na yun, yung RT-PCR, yun ang test para mahuli mo yung magnanakaw. Na nandun
While
siya talaga.
nandun pa siya sa ano.
Oo. Kasi yun na ang ipapasa at makakahawa sa iba. Kaya kung malaman natin na yung taong yun, dala pa niya yung mikrobo, yung magnanakaw sa kanya, ayan, kailangan mong i-isolate. Okay? Ngayon, kung gumawa kayo ng rapid antibody test, ano makukuha mo doon? Mga ebidensya lang na nandun siya, dumaan siya. Minsan nga, wala pang ebidensya. Halimbawa, yung magnanakaw pumasok, pero alam niya na may video camera na ilaga niya, hindi mo nakuha. Kasi may mga taong nagkaroon ng infection, pero walang ebidensya, hindi sila nag-develop ng antibodies. Kaya yung rapid antibody test, hindi ganun ka-useful. Kaya sinasabi ng DOH, wag na masyadong gamitin yan at wag mong gagamitin yan para sabihin kung ang tao okay o hindi. Kasi wala kang ebidensya para sabihin yun. Kasi wala na eh. Wala na yung magnanakaw eh. Ang alam mo lang dyan, nagkaroon ng ebidensya na dumaan. Pero hindi mo alam kung makaka-infection pa siya.
So sir, is it safe to say that results from rapid testing are inconclusive?
Yes. They should not be used to say whether you're fit to work or not. Okay? Although ganun ang ginagawa ng marami. Kasi maski negative yung antibody test mo, hindi mo alam eh. Hindi mo alam, pwedeng negative yung antibody test mo pero meron kang virus sa ilong eh. Pwedeng positive pero meron, pwedeng wala. Kaya hindi mo magagamit. Kaya ang sinasabi, huwag mong gamitin yan para mag-diagnose kung ano yung sitwasyon ng tao na yun.
So, sir, please correct me. I will try to, in my own words, sir, try to see if I understood it correctly. So, sir, there are two possibilities. Possible na negative ka talaga, meron na lang naiwan ng mga traces, pero hindi ka na talaga nakakahawa. Tama ba yun, sir? Tama ba yung intindi natin? That's one possibility. Another possibility is meron ka talagang COVID-19, you have contracted it, but your body has not developed the antibodies yet. Kaya lalabas sa result ng rapid test ay negative because the rapid test only looks for the antibodies, not the virus that causes the COVID-19. Tama, sir?
Oo. Tama yun. So, ang ibig sabihin yan, whether or not positive or negative yung antibody test, mahirap i-interpret kung ano yung COVID-19 status mo, kung nandyan yung virus sa'yo.
Sir, you touched on the process kanina. When we do RT-PCR, it's the swabbing. When we do the rapid testing, it's usually from the blood, sir. Sir, malaki ba ang difference in terms of accuracy? I mean, we've touched on the inconclusiveness of the results, but sobrang laki ba, sir, ng difference in terms of accuracy ng RT-PCR and rapid testing?
Alam mo, both tests have their own strengths and weaknesses, ano? Pero yung antibody test, unang-una, iba-iba yung mga kalidad ng mga tests on the market. Merong nakaka-detect ng antibodies accurately, merong hindi. So, hindi kasi nakakasiguro dyan unless sigurado ka dun sa antibody test na yun.
Okay, sir.
Ngayon, dun sa RT-PCR, pareho rin. You should be doing the test in a lab that does it well. Kasi pwedeng magkamali ka rin sa RT-PCR. So both are prone to error. Okay? Pero that's a separate issue from the issue of what the test actually detects.
So sir, while we're in this conversation, you mentioned na meron din namang plus strengths itong rapid testing. Is there any use? In what way can we use rapid testing, or in what way can rapid testing be of help sa atin ngayon as we face this pandemic?
Ano ang recommendation dyan is to do it to try to measure how many people in the population have had exposure to the virus. Ibig sabihin yan, dun sa ating analogy, ilan sa mga bahay dito sa ating syudad, halimbawa, ang napasukan na ng magnanakaw.
Tama.
Yun ang usefulness nun.
But not to
para alam
say
natin
if...
kung ilan ang napasukan, oo. Pero hindi natin masasabi na yun ang mga bahay na yun kung meron pang virus doon.
So sir, right now kasi, I mean, like I mentioned kanina nga, I have friends na talagang in their workplaces, ito pa rin yung ini-implement, rapid test to clear them, to say na they're safe to work and all that. Despite the pronouncements na ng DOH, sir, do you think na kulang pa tayo when it comes to disseminating information regarding rapid tests? Because it's still being used despite these pronouncements by DOH. What can we do?
Alam mo, nasa decision siya ng mga ng mga gumagamit. Kasi I think ang nangyayari diyan nagiging just a psychological crutch na nagkaroon ng test at saka ito yung resulta. Even if the test doesn't mean very much.
Opo. So sir,
yeah, kailangan talagang magkaroon ng better education kasi in the end, you're wasting money.
Tama.
Aksaya ka ng pera.
Because even in Congress, sir, it's being discussed. We're talking about COVID-19 responses, allotting budget for the government's measure, ganyan, and there are allocations for testing. And in one of the hearings that I attended, mayroon discussion about rapid testing. DOH, would you recommend? Because we will allot money if you will recommend that we use it. Ganyan, sir. So the thing is, it's still on the table when supposedly it should not be on the table at all. At least at this point in time that we are still trying to, nandun pa lang tayo, kumbaga, sir, sa trying to locate kung sino ang mga positive and negative. And as you said, sir, inconclusive itong mga results, sir. So, sir, right now we are at 70,000 cases. We have actually breached 70,000 cases. Experts from UP are saying that kaya pang tumaas itong numbers na ito, sir. Sir, in the context of testing, how can we improve the testing measures that are being implemented right now, sir, by the government para at least mapabagal itong at least to have more effective testing measures?
Alam mo, the principle of testing is really to identify infectives so that you can isolate them. So we must test, but at the same time, isolate when you find the positive. So in order to control the epidemic, you must test as many as you can and isolate all those that are positive so that they don't transmit it. So to answer your question, yes, we have to ramp up testing some more. Ang ibig sabihin yan, you have to have a strategy to test who needs to be tested.
Tama, sir.
Yun ang problema ngayon. Malaki na yung capacity for testing. Pero sino ang itetest? At kailangan mong kumuha ng swab sa mga tao na yun. Okay? Yun ang, dun medyo, naglalag behind tayo. We've been able to build capacity, but we are not really getting the people who should be tested. And really, you want to test regularly. Kasi you can be tested today, but be positive, be infected tomorrow. So there has to be a program for regular testing, particularly for people that are in high risk situation.
Sir, as someone who had a previous experience in handling pandemic, sir, what should we, granted that there are differences between how we handled SARS back then, may difference din between SARS and coronavirus, COVID-19. Sir, how should we select kung sino ang dapat nating i-test? Because now it's very clear that we cannot test everyone. The palace has said that we don't have the funds to test everyone. Now, how should we select who should we test? Who should we prioritize and all that?
The DOH already has a list. Kasama dyan yung mga workers in critical and essential agencies. Agencies that have to remain open. You have to test those employees regularly so that you can prevent any outbreaks there. Because if you have an outbreak there, people go on sick leave, and then the agency doesn't function. So you have to test critical government agencies. You have to test people that are working in public and private utilities regularly. Those that have really economic, how would you call it, implications. If the industry or the agency is handicapped by infection. And then, for example, if you want to open your tourist bubble, so to speak, you have to test all of your waiters and all of your frontline workers there regularly. So that, you know, the tourists will have confidence that they're going to a place where people are tested and there's not likely to be infection. So may listahan na yung DOH yan kung sinong dapat tinetest. Ngayon, of course, private sector will want to test their employees.
Tama.
So they'll test their employees. Ngayon, ang pag-uusapan dyan is yung sharing of the costs for the testing. Okay? Because it's also not just testing. It's funding the cost of the test. That's important to solve.
Sir, one last question actually. You have a question sent here. What is the difference between the testings being conducted here in the Philippines with the testings conducted overseas na kumbaga they are winning their fight right now against COVID? Kumbaga sir, in a way, how can we, ano yung pwede nating gayahin or from na practices ng other countries in the context of testing, sir, here that we can apply here in the Philippines to beat this pandemic?
You know, the fundamentals are the same. It's just that their implementation is most likely tighter and faster. For example, we can do as many tests as possible, 30,000 a day. But if the turnaround time is 3, 4, 5 days, you're not doing it as well as a country that can turn it around in 6 hours. Diba? So comparing that we've done the same amount of tests, you'd have to dig deeper and ask questions about, you know, what's the turnaround time? Were the people who were found positive actually isolated? Because you'll find that's where the weaknesses are. We know where the weaknesses are. We just have to solve them.
It's not just about the number of tests that are being conducted, sir. No, kasi like what you said, if it's 3, 4, 5 days, maybe in the 4th day of waiting, nag-positive na pala yung patient.
Yeah, it's that na ano kung positive siya, and you only know that he's positive 3 or 4 days later, he's not isolated early enough. Yeah.
Okay, thank you, sir. Sir, any message to the public right now? What should we do? Paulit-ulit na natin pinapaalala sa...
Ang masasabi ko lang sa public is that expect more cases. Expect more cases. Expect that the epidemic will spread. But it doesn't mean that we should stop stop trying to control it. Because in the end, we have to slow it down. Even as it propagates, we have to slow it down. Yung tinatawag na reproductive rate. Now the reproductive rate is 1.5 to 2. We have to bring it down to 1 or lower. But the epidemic will spread, whether here or in any other part of the world. Every country is in constant threat.
Okay, so thank you so much, sir. Again, the former Health Secretary Manuel Dayrit. Thank you so much for your time, sir. I hope you're safe. And I know marami din kayong ginagawa right now. So thank you so much for giving us a bit of your time. Again, this is Neil Arwin Mercado, reporter for INQUIRER.net. Everyone, please stay safe.
Thank you.